Now we are moving on to something serious. Serious in the sense that we are going to talk on health. And what we are going to look at is coping with sickle cell anemia amidst a pandemic, most especially in this COVID-19 era. How are they coping, people living with sickle cell anemia? And I have some people here, they are siblings. They are going to talk to us on that and what informed their decision to come up with a foundation to that effect. So, join me in welcoming Mr. Maxwell Benjamin Eneche. He's the director and coordinator of the Samvic Eneche Health Trust Fund. You're welcome to Good Morning Abuja.
Yeah, good morning. Thanks for having
We are
me.
glad to have you and Happy New Year to you.
Yeah, thanks for having me.
All right.
Yeah.
And next to Mr. Maxwell is his brother, Mr. Patrick Eneche. He's the co-founder of the foundation. You are welcome.
Thank you very much, madam.
Happy New Year to you as well.
Happy New Year to you, madam.
All right.
Thank you.
So let me start with you. How is life, or how has life been before COVID-19 as a sickle cell person?
Okay, actually, I would say, let me just give a little history about myself,
Okay.
how I started and how it has been before COVID-19. In the year 1996, I was diagnosed after I lost my immediate younger brother, the one next to me called Maxwell. I was diagnosed a sickle cell patient. Before then, I was wrongly diagnosed by two teaching hospitals, one in Macaulay and one in Eneche. That I was AS. So, and that made them to give me a wrong treatment. So I was on that for a very long time until my uncle, after the death of my immediate younger brother, my uncle brought me out to see Professor Charles Wambele when he had a research institute then at Idu in Abuja here. So then I was confirmed a full-blown sickle cell patient. So then they started managing me. So I was okay until 2004, 2005. My second year in the university, I came down with this crisis and I was rushed to the Federal Medical Center, Lokoja, and diagnosed that I had septic arthritis of both knees. So I was operated upon and it was not properly managed. So then I lost my both knees, bedridden for 3 days. After then, I left the shores of this country. Being away for more than a decade, I didn't have anything about.
So along the line, you were
Yes.
dropped out from the
Yes,
school.
yes, I was dropped out from the school.
Okay.
Then when I left the shores of the country around 2008, 2009, I then started continuing my education overseas
Okay.
and obtained my bachelor's and postgraduate there. I then had no issues with crisis for that 11 years I spent overseas until I returned home in 2019 with my family for a vacation in Nigeria. And upon arriving between 2019 and December 2018, I had come to hospital triage and the crisis was much. So I was hospitalized for about three weeks.
Okay, before I allow you to continue, why is the crisis not occurring over there? But when you came back, it started reoccurring.
No, what I see there is one, it's weather and environment.
Okay.
One, we have malaria here. Malaria triggers crisis in Nigeria
Okay.
for sickle cell patients. And secondly, our kind of water we drink here are not properly treated. We can get typhoid from the kind of water we take daily. And thirdly, the stress nature, what we go through. Like when I was overseas, I drive, as you see me with my walking stick. I drive. I walk into the mall or my building. There are elevators. There are ACs everywhere, whereby you don't get stressed. But in Nigeria, it's not like that. And when a sickle cell patient is not supposed to be fatigued, you're not supposed to sweat too much, and you're not supposed to be under too much of cold.
Okay.
So when I came to Nigeria, the stress became very much for me because moving around was a bit much, and it's like when I am here, the mosquito, no matter how you try to treat it, you try to prevent it, they still come out because you are not only always indoor. You must go out, and you are being bitten by mosquitoes. So these are the things I feel like. And secondly, while I was overseas, I was introduced to a medication called hydroxyurea, which was keeping me. And coming to Nigeria, it's a bit
Difficult to get it.
Yes, because it's a bit expensive.
All right, now in a nutshell, there are so many factors that triggers sickle cell
Yes,
anemia
yes.
from what you just said.
Exactly.
All right.
Yes.
Now, we'll leave the conversation here for now.
Okay.
Let me ask your brother. He is your brother.
Yes.
You are AS.
Yeah. No,
You
I
are
am-
SS
I am
now.
SS, yes.
But initially, you were diagnosed AS.
Yes.
Okay.
He is
What's your
AA.
genotype?
Yeah, I'm
You are AA.
yeah.
Okay, perhaps maybe I should ask this question from the parent point of view.
Okay.
Where your dad and your mom,
Yes.
are they both ASAS?
Yes. It was after we got to Professor Charles Wambe's research institute that we confirmed the whole family that we had one AA, one AS, and my parents were both AS, and I was an SS.
Okay.
Yes.
So let me hear from your angle.
Okay, how that is about? Okay, the parents who produce sickle cell.
Is it possible to get AA from parents that have AS and AS?
Yes, that's what it is.
Okay.
You can, because one in every chance. How the math is one in every chance of 4 children could be an AA.
Okay.
Without traits at all. There wouldn't be carrier to even transmit to an offspring. Then 1 in every 4 chances as well could be an SS. Then 2 out of every 4 chances, that's 1 in every 2 chances of 4 children could come out to be carriers of the sickle cell disease. And carriers of the sickle cell disease are AS, those people who still transmit to, they are not sickle cell
Patients,
disease
yeah.
patients.
Okay.
They are not sickle cell disease patients. They are just carriers. They could, if they mate with other people who are carriers, they could come up with a child who has a sickle cell disease.
Okay.
And like I said, how the graphics plot, it's 4 chances. So in every, if there is a miscarriage along the line, those numbers are counting.
Okay.
So if you had an AA initially or an SS initially, because
That was
it has
miscarriage.
it has to be 4
All
children in every circle. So in that 4 circle, the first circle, if you have an AS 2 in every 4 chances, like I mentioned, then the third maybe an AA and all of those. That way you could have 1 AS in every 4 chances, 2 AS in every 4 chances, 1 AA in every 4 chances,
Okay.
and 1 SS in every.
All right. Now, I want to come back to you, Mr. Patrick. Having mentioned that overseas, you see that the occurrence of this is less, and we have environmental factors that trigger it apart from the hereditary nature of the disease. In this COVID-19, how have you been coping? Because if you are in Nigeria and you have mentioned several factors that could make this situation worse, so how have you been coping as an SS? How have you been coping since the inception of this COVID-19?
I would say it's been very difficult because each time I come down with crisis, all right, I'm comparing it with how I've been managed over there. You know, our medical system here is very, very poor. Now, I've been rushed to hospitals. I can't get a good medical care in Kogi State. I have to drive all the way to Abuja to get a better care. Within the time I had crisis, I was rushed down. Imagine that within all this period of COVID-19, and rushing down to Abuja, you have them doctors telling you they are being tied down because they are attending to COVID cases.
Now, how do you advise government most especially those in the health sector, to reduce this problem?
Now, the only advice I have to the government is let them put more money, one, on research, secondly, to build more facilities. Third, a sickle cell patient should not be attended by any doctor except a hematologist.
All right, let's leave it there for now. The foundation now, how did it come to be?
Okay, first off, the foundation was launched in 2016 after the death of my second sibling. It's a merger of two names, Samuel and Victor Eneche, and these were from both the same family.
Okay.
And the foundation was launched after the death of the second one. This was because we had seen that even with the much knowledge we had in sickle cell anemia or in managing sickle cell patients, we still saw that it was very, including the financial involvement and all of those, we still saw that a lot of people out there were malinformed about this menace that's bedeviling the human race. And
so you are creating awareness.
Yeah, when the second sibling died, the family came together, of course, championed by one of the patients that we had, that we have that is still alive.
Yes.
Yeah, and he is a co-founder with my dad. So they came together. We thought that how could we, at least since we have this predicament within us, how could we give back to the society? Since we know that, okay, a lot of people are not aware of this menace and are still going. Of course, they during their own time were not informed about that, so there could be excuse.
Okay.
But right now, there's too much knowledge around that people are not tapping from, and so we thought to come up with the awareness in 2016. Now, how could we do it? We had to immortalize that dearly beloved that had departed already.
Okay.
So we named it with Samvic, Eneche Health Trust Fund.
Okay.
Afterwards, we had to, since it was a child NGO just coming forth, we had to partner with a sister NGO, Total Child Care, which was already fully operational, to help us, show us around how to go about the business of maybe a foundation and all of those, how we could reach out to more people.
And so far, it's doing well.
Very, very well.
Okay. So before we round up, can you speak to sickle cell patients out there and give them hope?
All right. One of the things I will tell to sickle cell patients is, just as it's stated that we are warriors, we are always warriors and will remain warriors. Definitely. Now, you don't need to give up. I have seen, just as I stated when I was giving a brief history about myself, I bedridden for 3 years. One thing that kept me going was determination. You have to keep on your hope. Do what you need to do to be alive. Hydration. Keep on drinking a lot of water. Now you need to see doctors that insist on seeing a hematologist to handle your case.
Hematologist.
Yes.
Okay.
And for sickle cell patients, they are not supposed to be discriminated. And don't feel, one thing is, a family that has a sickler should not hide it. One of the things that kept me alive is my parents were always speaking. They were talking to people. If you keep the information, you're killing your child or your siblings.
Okay.
Silently.
All right, that's noted.
Yes.
Thank you so much, Mr. Patrick, for that insight and for speaking to sickle cell patients out there. I'm sure your coming here is not in vain, and because some people may learn something from this. Yes. Thank you so much, Maxwell. Yes. Keep on the good work and keep hope alive.
Thank you very much.
Okay.
It's a pleasure.
Yes. I've been speaking with Maxwell and Patrick. They are siblings. Maxwell is AA and Patrick is SS, and they have narrated their stories, which is so inspiring.